Hello, welcome to Human Trafficking. My name is Ann Boatright, and I'm from the Nebraska Office of the Attorney General. Thanks for joining us today. So first, let's start off with what human trafficking is. There are two different types of human trafficking, and human trafficking is considered modern-day slavery. We break these types of human trafficking into labor and sex trafficking. Labor being someone being forced to provide services or labor to someone either for a decreased monetary amount or in exchange for something, some sort of goods. And then sex trafficking, where they're exchanging a commercial sex act in exchange for monetary value or something of value. So for the purposes of this presentation today, we'll mostly be focusing on sex trafficking, but we wanted to at least provide you with information that both exists. We also see that sex and labor overlap a significant portion of the time. So in terms of what trafficking looks like in the globe today, we know that when you combine both sex and labor trafficking, we're talking about a $150 billion industry globally and growing. We also recognize that victimization is often beginning prior to adulthood, thus an issue for us in the public health sector so that we can provide children and adults with the proper care needed. In terms of legal definition of sex trafficking, we recognize that the legal definition here in the state of Nebraska, along with U.S. statute, is the recruitment, harboring, transportation, provision, solicitation, or obtaining of a person for the purpose of a commercial sex act in which that sex act is induced through force, fraud, or coercion. Now we'll get into what force, fraud, and coercion looks like in just a minute. And then also there is one exception to this definition. If we do have someone specifically related to sex trafficking who is under the age of 18. So force, any form of dominance, control, influence, violence, or physical pressure. And again, we'll explain that further. Examples of force are going to look different than we expect them to look. Oftentimes when we talk about trafficking, we expect that someone is going to be abducted off a street corner. We expect them to be held forcefully in chains and have the inability to escape in any way, shape, or form. But when we see force, we often see it applied in a different manner. It can be through physical assaults, it can be through sexual assaults, through emotional abuse as well, but it's not as much the physical captivity that we see or expect to see in these cases. One example that we have, a victim told us that she witnessed her trafficker talking about how the first time he started going off and the first time I had seen him beat one of his other girls was a 28-year-old girl. She had witnessed this violent attack on her 28-year-old female who was also being trafficked by a perpetrator. That is an example of force. Him beating the other girl in front of her prevented her from feeling like she had any ability to escape at all. Fraud. Examples of fraud. In the end, it will just be you and me. Everything you earn is for us. I'll make you rich. I'll take care of you. We're going to split it. I love you. We see this very commonly in our cases of trafficking. And if you'll remember back to the legal definition, we only have to prove one of these, force, fraud, or coercion. With fraud specifically, we see oftentimes that it is that manipulation through a relationship, so someone pretending to be someone's boyfriend or someone promising to take care of someone. And lastly, coercion. It can be physical or non-physical harm, but it's targeting those victims' vulnerability. It can be psychological or financial abuse. We often see too that when a victim has a vulnerability, that trafficker seeks out what that vulnerability is and then looks to exploit that further, such as a victim potentially has a drug addiction issue. We take that drug addiction, we tell the victim that they need to make a certain amount of money, and if not, the drugs that they are addicted to are not going to be available. Those are oftentimes the cases and how these cases manifest. This whole slide. So in terms of the landscape of exploitation, we are seeing different types of trafficking that occur within the state. We do see the traditional trafficking, where we have a trafficker or pimp who is exploiting a particular individual. We see family-based trafficking, where a parent or guardian is selling their child. Gang-based trafficking, where gangs or a group of individuals are selling other individuals. We see peer-based trafficking. And then lastly, we do see independent or survival sex. When we're speaking of minors and independent or survival sex, we know that a minor cannot consent to sell themselves for sex. However, we do know as well that when a vulnerability exists, such as a victim is homeless or doesn't have a place to stay, that they may end up turning to a sex act to survive. So what do traffickers look like? There isn't a one-size-fits-all for a trafficker. They can be parents, as we've discussed. They can be female or male, and not one person is, more likely to be a trafficker than another. It just depends on the situation that currently exists and a person that is willing to take that step to exploit another. In terms of breaking down sex trafficking of a minor, to break that down further, helping to sell or trying to buy, trading anything of value in exchange for a sex act or pornography with a minor is illegal in the state of Nebraska and in the U.S. We recognize that any person under the age of 18 cannot consent to sell themselves for sex, and oftentimes when a minor is engaged in sex acts, they are more likely to be exploited by people who can manipulate those vulnerabilities that minors have. In terms of the missing youth that we see nationally, in 2018, 23,500 plus runaways or missing youth were reported to the National Center for Missing and Exploited Children. Of those, it was estimated that 1 in 7 were likely victims of sex trafficking, and of those, 88% were in the care of social services during the time that they went missing. In terms of sex trafficking in Nebraska specifically, here is a map that illustrates the location of reports of human trafficking since 2016. You can see that there isn't one area that is more prone to having sex trafficking in it versus another, and that it does reach all across our state in various size communities, small, large, medium, all over. So in terms of how traffickers operate, we know that traffickers are going to look to exploit vulnerabilities and marginalized status. Those that have prior history of trauma, those with immigration status issues, LGBTQ, those that are young or have particular mental health issues, those with poverty or homelessness issues, those that are in neglectful situations or in the child welfare system, those that have substance abuse. Ultimately, traffickers are looking to control these populations with fraud, coercion, and ultimately force. We know that victims oftentimes get approached through social media websites, and that they are coerced or frauded into these situations through social media. How traffickers operate further. We know that traffickers are going to work to isolate victims from family and friends. Oftentimes they're going to appeal to love. Sometimes they will use physical, emotional, verbal, or sexual abuse. Sometimes they will use forced substance abuse, or they will make substances available or not based on one's addiction status. They will oftentimes appeal to fear and ultimately trick victims. It's ultimately about power and control for these traffickers. In terms of the warning signs that we see victims sometimes having in the healthcare setting, we see sometimes that they will have unusual tattoos. A victim may have tattoos of a dollar sign or potentially a barcode. They may also not have any tattoos, so it is important to look for all sorts of signs when you are talking to your patients. They may have several cell phones or the inability to hang up a cell phone. That constant control through cell phone is common. They may not have ID, or their ID may be controlled by others. They may have large amounts of cash, or they may not have any cash. They may have large amounts of hotel keys, a relationship which raises suspicion between individuals. So if we have someone who is significantly older than a victim, or a dynamic that raises our suspicions, those are the situations that we should try and investigate further and report to law enforcement. Victims may be unkempt and malnourished. They may be disoriented as to the location in which they are, and they may have evidence of inflicted injuries as well. So to break down traditional sexual abuse cases versus trafficking, when a victim comes in for a sexual abuse case, typically they're going to disclose to us in the healthcare setting that they need some further help, that they've been sexually assaulted or abused in some way, shape, or form. With trafficking victims, we actually don't see that disclosure. They're going to not actively see themselves as victims and deny that to us. Oftentimes their behaviors are labeled as people in the community as naughty or promiscuous versus their victimization. When someone is under the age of 18 and they are exchanging anything for value in exchange for a sex act, that is considered trafficking. And adults who purchase minors can be held accountable based on Nebraska law. We also don't have consent issues when it comes to these trafficking cases. So in the state of Nebraska, if a victim is 15 years or younger and they are consenting to have sex with someone who is 19 years and older, they are unable to do so. And thus, that constitutes a statutory sexual assault. When those situations arise, it is our duty in healthcare to report that to law enforcement as a crime is being committed against a minor child. With trafficking, however, any victim under the age of 18 that is exchanging anything of value for a sex act or pornography, again, can be classified as a trafficking victim. And we must hold those adults accountable who are purchasing that minor. Let's talk about healthcare and trafficking now. The Beasley Institute for Health Law and Policy did a study in 2014 where they surveyed sex trafficking survivors. When they surveyed these sex trafficking survivors, they asked them how many of them had seen a healthcare provider during the time they had been trafficked. What they reported was that 88% of them had seen a healthcare provider during the time that they had been trafficked. And that is why this is so important for all healthcare providers to be educated on this issue. When victims came in, oftentimes they were coming through a hospital or emergency room setting. 63.3% were coming through there. But 57.1% were coming through any type of clinic as well, which is why, again, we all in the healthcare settings, regardless of if we're in hospitals or in clinics, must be aware of these patients. So why patients are going to come through healthcare settings? Patients are going to oftentimes come in for a variety of complaints based on what they've been exposed to. It may be things such as an STD. It may be things such as a need for medical care related to an injury. And oftentimes they will not have disclosed. Medical providers can and will identify these patients first. And the medical providers are going to get these disclosures over many other disciplines, such as law enforcement or other areas, due to the fact that we are so trusting in nature, and we are able to provide patients with help oftentimes that they need. When we talk about what these patients are going to require, they are going to require our Child Advocacy Center, specially trained forensic nurse examiners, FNEs, or sexual assault nurse examiners, sexual assault or SANE nurses, advocates that are trained, and trauma-informed law enforcement as well. Because if we fail to get them the resources that they need, they're most likely going to end up back into this situation. So some of the examples that we do see for victims who come through the healthcare setting: children missing for care, presenting for a medical care well check. So someone who has been gone 48 hours that returns and is in need of a medical report. Someone who is reporting a sexual assault related to a statutory sexual assault or otherwise. someone who has sustained injuries through an assault, whether it be sexual or physical, STD treatment, pregnancy care of any kind, psych or mental health issues, and many others. When we are screening of these victims, it's crucial that we are engaging with this victim alone. Make sure that we're using appropriate screening tools, such as those put forth in the Nebraska Hospital Association Toolkit, and make sure that any significant other, friends, relatives are removed from the room. Remember, there isn't a one-size-fits-all when we're talking about traffickers, and relatives or others could be perpetrators or members that are under the control of the trafficker. Thus, we must make sure that our patients are safe. We also have to discuss confidentiality and its limits, ensuring that victims are provided with any sort of needs that they have, and assessing for those acute medical needs first before we are discussing evidentiary needs. If all else fails, make sure that we're safety planning before that conversation ends, so that victims have a way out in the future. Oftentimes, victims may not be ready at that very moment when we do screen them. And if so, make sure that they have a contact if they are going to leave your facility. So here's a heads mnemonic that we oftentimes use to screen at-risk youth. It's important to make sure that we are not asking these types of questions in rapid-fire sequence, but it is important to get to know your patients, to dive into some of those issues that could be, surrounding their home life and places that they are living. So if we have a known victim, a victim that comes in and reports that they're being trafficked, or a victim that discloses once we begin to engage with them, we want to always make sure that we're discussing the resources that we have available, and we'll talk about some of those resources in a minute, but also making sure that we've engaged our community partners. So we talked a little bit about advocates and law enforcement and the crucial partnership between all three of us in healthcare, law enforcement, and advocacy. Much like in any other discipline, we would not care for a patient by ourselves. So if a patient comes in for a cardiac issue, we wouldn't just have the ER only provide care to that patient and provide no other resources. We, with a patient such as that, are going to consult cardiology. If they need additional resources, we're going to consult those additional resources. And so caring for victims of trafficking is much the same. We want to provide victims with multiple people that can help surround them as they go through this process. Make sure that we're not being investigators. We are there to provide great medical care. It's important that we don't document things such as alleged sexual assault or alleged domestic violence, alleged trafficking, because we don't document that for any other classification of patient. We want to be consistent in providing those patients with great care every single time. We also want to know those resources ahead of time. So in terms of the health consequences of sex trafficking survivors who were surveyed by that Beasley Institute study that said 88% of them saw a healthcare provider during the time that they were trafficked also reported a significant portion of the time having health complaints. 99.1% of survivors reported that they had any physical health problem during the time they were being trafficked. Of those, 91.7% reported neurological issues, 86% reported general health issues, and 69.2% reported injuries. We also saw that 68.5% reported cardiovascular or respiratory issues, and then 62% with GI issues, followed by 54.3% with dental issues. So if you have a victim, now what should you do? Make sure again we're engaging that community response team. Know those resources in your area and make the connections. Who in your area can help? What should activation of your team look like? It's easy for us to tell you what it should look like in your community, but you know your community's best. So make sure you're engaging with what resources you have in your community so that victims can get the best care possible. Know what numbers to call, know what resources are out there, because your victims depend on it. In terms of reporting processes, we want to make sure that we are always mandatorily reporting when we are supposed to. In the state of Nebraska, any victim who presents for medical care relating to a crime that has been committed must be reported to law enforcement the circumstances surrounding that issue. If a patient is sexually assaulted and they are an adult, meaning 18 years and older, they do have the option to anonymously report their sexual assault if a weapon was not used or they do not have serious bodily injury. Those are the only exceptions to the mandatory reporting process. With children, so victims that are under the age of 18, we must report any suspected or known abuse to law enforcement along with our Child Protective Services. So that's our CPS hotline. In the state of Nebraska, the easiest ways to report to law enforcement and Child Protective Services are 1, calling law enforcement through 911 and calling Child Protective Services through their hotline, which is 1-800-652-1999. We also can engage with forensic nurses or your SANE nurse, your FNEs or your SANE nurses, your sexual assault nurse examiners. If you have a healthcare facility in your area that has a SANE or forensic nurse, that can be a crucial piece to providing those resources and connections for victims of crime. We also can engage with our child advocacy centers, and we have 7 of them across the state of Nebraska. We'll show you a map of your areas all across the state in just a little bit. We also want to engage again with law enforcement. We have multiple law enforcement agencies all across the state that are ready and able to help with this reports. If you are unsure of the jurisdiction or you have a victim who has crossed multiple jurisdictions, the Nebraska State Patrol stands ready and able to help with any sort of reports that are needed. So it's crucial that we listen, believe, and respect these patients. People who have experienced trauma will not most likely share everything that they have experienced all at once. It's important for us in healthcare to believe these patients. Start by believing and build trust first versus focusing on facts. Remember, when patients experience high levels of trauma, their prefrontal cortex and that frontal lobe is going to shut down. And that is what records our memories in chronological order. So when you have a victim that has some pieces of their assault that pop in and out, or they don't remember necessarily in chronological order, that is not unusual. And remember that disclosure is a big, big first step. It's important to respect these patients and provide those support services as needed, no matter who it is. So it is on us. The system has failed these victims many times. We have missed the signs and symptoms when these patients have presented to our facilities multiple times. It's natural that these victims are going to test the system when seeking help. And we have to be ready to engage and ask questions of the victims and be ready for those true answers. When we're screening victims for violence, we must make sure we're engaging that victim alone, that we're making eye contact with that victim, and that we're really trying to build an environment of trust for the children, for the adults within our systems, so that we can encourage them to come in and get help. We need to encourage them to have open communication for us, and if they can't leave their situation at that very moment, then we need to encourage them to return for help when they can. We also need to empower them by researching options that are available out there in terms of services for them. So in terms of what we're doing statewide, we're charging every institution with what policies does your institution have. Who are you going to call and what are your next steps going to look like? We have some example policies here available for you on the Nebraska Hospital Association website in our toolkit for trafficking. But we also would encourage you to create your own and help to identify these patients in a more trauma-informed manner. Here is a list of all the Nebraska Child Advocacy Centers. As you can see, based on counties, they are highlighted for each Child Advocacy Center. We have 7 CACs that stretch across the state, with multiple locations that have satellite CACs as well. So know those local contacts. Make sure you know who your Child Advocacy Center staff is. Know your domestic violence and sexual assault programs across the state as well. We have a sexual assault or domestic violence program that covers all 93 counties of Nebraska. The Nebraska Coalition to End Sexual and Domestic Abuse has a map where you may be able to visualize your local area and see the hotline. They run 24/7 hotlines for each of the domestic violence sexual assault programs, so that again you have availability of advocates 24/7, 365 all across the state. We also have safety trafficking specialists, so that's the Salvation Army's fight to end trafficking, and they have 3 specialists across the state of Nebraska that can provide additional resources as well. The Nebraska State Patrol also stands ready to help in terms of law enforcement response, along with your local law enforcement. And then lastly, your sexual assault nurse examiner programs or your forensic nurse examiner programs located all across the state as well. But we cannot do this alone. We need you and we need your support. We need you to help identify these victims. We need you to help provide that great medical care as we've discussed and hopefully get the victims the help that they need. If you suspect that someone is being trafficked, it is crucial that you call 911, especially when a perpetrator is present in your facilities or with a victim. Those situations can be life-threatening, and so we definitely want you to call 911. If you have other information that you would like to report as a tip, you can also report to the National Human Trafficking Hotline, but remember that isn't going to be emergency response situations, so treat it as a hotline as such. But that number is 888-3737-888, or victims can text HELP or call that hotline. So when they text HELP to 233-733, both those are 24/7, 365 as well. Thank you for being here with us today, and we hope that you have learned about trafficking.